Hello and welcome. Today, we're delving deep into a subject that, while often overlooked, presents a rich tapestry of challenges and insights within dermatology. This is lichen striatus, a condition that captures the complexities of skin pathologies. Join me as we explore the intricacies of this fascinating condition with the precision and care it demands. Lichen striatus primarily appears in children and shows a mysterious preference for females. Its sporadic emergence and the global variance in incidence rates pose unique challenges in understanding its patterns, essential for effective management across diverse populations. At the heart of lichen striatus is a pathophysiological puzzle. Advanced studies have illuminated aspects like clonal T-cell activation, suggesting an antigen-driven process, and significant cytokine involvement, notably IFNG and TNFA, which underline the pronounced inflammatory response at lesion sites. The clinical manifestation of lichen striatus is not just about appearance, but texture. These papules can become lichenified or scaly, challenging us to look beyond the visible. Occasionally it even affects the nails, causing grooving and pitting, key diagnostic clues in atypical cases. Diagnosing this condition requires precision. Tools like high-resolution ultrasound and reflectance confocal microscopy provide us with a non-invasive view into the skin's morphology, revealing the underlying inflammation and characteristic dermatitis without a single incision. While often self-limiting, lichen striatus sometimes demands intervention, ranging from advanced topical agents that penetrate the skin barrier more effectively, to phototherapy, and even systemic agents in severe cases. Each treatment is tailored to patient needs, ensuring both efficacy and safety. Managing lichen striatus extends beyond mere treatment. It involves educating patients and their families about its benign nature, reducing anxiety, and ensuring they understand the importance of monitoring for any complications, such as changes in skin pigmentation or emotional distress. In conclusion, lichen striatus invites us to embrace the complexity of dermatology, combining immunology, genetics, and comprehensive patient care. It challenges us, enriches our practice, and enhances our ability to empathize and treat our patients effectively. Thank you for joining me on this exploration. I look forward to your questions and the discussions that I hope will follow.